Hello, everyone. Today I have Dr. Pedram Ghasri, who is a board certified dermatologist here in Southern California. How are you doing today, Dr. Ghasri?
Good, good. How are you?
Pretty good. Thank you for being here. Are you ready to get started?
Yeah, sure.
So, the question I always like to ask first is what really inspired you to get into medicine?
My father was a dentist in Iran. That's where we were born. So we kind of had this, you know, background of going into science and helping others and treating patients. And he enjoyed the field. I actually thought about dental school first, but then my older brother went to medical school and he actually became a dermatologist. So that's how I started getting exposed and went from there.
Is that why you chose dermatology because your brother was in it?
That was one of the reasons, yeah, yeah. I saw it was a very interesting field, get to see a variety of skin conditions, skin diseases, and then you get to treat all types of patients as well, um, from babies to their grandmas. You kinda some patients, you're their only doctor that they see, so you kinda become their primary physician too. So but yeah, there was multiple reasons. But yeah, my first exposure was through my brother. I had never even heard about the field really until
Yeah. And what was your kind of timeline to becoming a physician like?
So we do 4 years of college, and then I did 5 years of med school. So I did my first 3 years of medical school, and then when I decided in my 3rd year I wanted to pursue dermatology residency, I took a year off between my 3rd and 4th year to do a year of research at USC. And this is while I was at UCI Medical School. And then I did my 4th year of UCI and then applied to residency, and residency is 4 years. It's 1 year of internship, whether it's medical or surgical internship, and then 3 years of residency.
Yeah. What made you decide to take that research year?
I decided I set on dermatology more late in my 3rd year, so it's a very, very competitive field. I kinda wanted to improve my application a little bit more. I mean, I everyone who applies to dermatology has excellent scores on their tests, excellent grades, but you kind of have to, differentiate yourself in one way or another. And then I had heard about this interesting research opportunity at USC where they were trying to find a cure for a genetic condition called epidermolysis bullosa. It's a blistering disease in kids. So I thought, and I live locally in LA, it'd be nice to come back home for a year and yeah, pursue that.
Yeah, and what'd you guys find, if you don't mind me asking?
There was a so the condition, there's a protein that's missing. It's a genetic defect that causes a loss in collagen. So kids are born basically with horrible blisters and they eventually die from horrible skin cancers. So they were trying to come up with a way to introduce the collagen back in. There was several trials. None of them honestly panned out to the full like FDA approval. But now there are other conditions that other labs have found. So
Mhm.
it's getting there.
Yeah, at least there's progress.
Yeah,
That's
yeah,
what I like to see.
yeah.
So, in your day-to-day, what kind of conditions do you see or procedures do you do?
So the nice thing about dermatology is you get to I mean, we see a lot of patients in the day. Usually it's high volume, but every room you walk into, it presents something new. So, I'll go from one room, I'll see a patient with psoriasis for years. The next room, it's a baby with eczema or atopic dermatitis. The next room, I'm lasering someone's face for redness or acne scars. Then I'm cutting out a skin cancer, or taking off someone's mole to improve their confidence. Yeah, just a variety of diseases. But we see, yeah, mainly dermatology is mainly it's a component of medical, surgical, and cosmetic. So we get to see it all.
Yeah, and I think most people's idea of dermatology is the cosmetic side, but what is really the main difference between cosmetic dermatology and medical dermatology?
Um, you know, they throw out the term cosmetic dermatologist a lot. Unfortunately, a lot of those patients, those doctors, I feel like some are not dermatologists, which is a shame. They just call themselves that. But besides the point, medical dermatology, we treat a variety of skin disorders, the most common ones being eczema, psoriasis. We do a lot of skin cancer detection. You know, melanoma is on the rise, especially in young people. So we do full body mole checks. You know, if there's suspicious moles, we remove them. We send them to the lab for biopsy. If it comes back melanoma or atypical, we cut it out and we cure them. So that's the medical and surgical aspect of dermatology. And honestly, I enjoyed that aspect more.
Alright, yeah, and you're from the language that I was hearing, you can cure skin cancer?
For sure. For sure. You know, it's one of the cancers that there is a cure for. Um, you know, basal cell, squamous cell, melanoma. Fortunately, you know, if we catch them early, we excise them or we do a procedure called Mohs micrographic surgery where we cut out the cancer and then we check right there and then in the lab if the cells are removed. If not, we go back in right there, take out more, and if once it's clear, then we stitch them up and they're good to go. But then they do they do regular follow-ups with us to make sure they don't develop it elsewhere.
Yeah. What is, like, the main way to prevent skin cancer? I know sunscreen is a big
Yeah,
thing.
that's another
Um,
one.
alright. Is so just don't skip the sunscreen.
Exactly. You know, a lot of our patients right now in their 60s, 70s, they grew up in the generation where sunscreen wasn't a thing. Their parents never told them to do it. So I hear it at least every 5 times a day. You know, I used to lay out in the sun with uh the reflector, baby oil. Now, sure enough, you know, 30, 40 years later, they're coming in with growths popping up all over them. So yeah, sunscreen, and just you know, you don't have to avoid the sun. You just have to be smart about the sun. Yeah, just don't go out too long without sunscreen.
Yeah. Do you have, like, I guess, a brand you prefer or an SPF that most people should be using? Or let's get some specifics on what kind of sunscreen that people should be.
Yeah, I mean, I would say at least SPF 40, and you want to reapply. And if you're going to be out for more than 2 to 3 hours, I would reapply. Um, in terms of brand, you know, there's a million brands of sunscreen out there. In the office, we carry a brand called Elta MD that patients like. It's more cosmetically elegant. It doesn't leave that white residue, that white paste. Um, but yeah, there's tons of brands, but most people forget to reapply, especially if you're out for a while.
Yeah. So dermatology has this reputation of being a very cush specialty. So in that reputation, what's the most difficult part of your job?
I mean, you know, compared to orthopedic surgeon, it's it is a lot more
Yeah.
on the side. But you know, dermatology it can be whatever you make of it. You know, there's physicians who work 1 day a week, you know, part time because they have a family to take care of or whatnot. Um, but it depends how many patients you want to see too. So our practice, we're very high volume. Um, so in that sense, it's not cush because we're treating a lot of patients in a short period of time. You know, as soon as you walk in the room, your brain has to start thinking about the diagnosis and the treatment plan, all while the patient sometimes is telling their life story. So, uh, but we got to treat them right away. But were you asking what the challenging part is?
Yeah. What your most challenging part is.
Yeah, I think um, so. I think the best part is the patients, and sometimes the worst part could be one troublesome patient. I mean, our practice, we're fortunate to have, you know, really amazing patients that we've grown with over the past 10 to 20 years. But, you know, sometimes there's patients with unrealistic expectations. They expect their chronic disease of 20 years to be able to be cured right away in one visit. So we have to set those expectations. The other challenging part, I think, of being a physician in general is dealing with insurances, trying to, you know, get the right medication for the patient or the right procedure approved for the patient. Whereas like some admin, you know, who's never seen a patient in their life is making these decisions for you. So that's challenging as well.
Yeah. Insert like recent news event here.
When you know, yeah, the United Health, yeah, forget.
Yeah. Um, so when me being on social media, kind of the medical side of social media, I'm seeing like these posts of like weird, obscure rashes that have just crazy names and crazy etiologies and stuff. When
Yeah.
you were in school or as a resident, what was your way of like remembering all of these different conditions?
Yeah, so I mean, dermatology residency is almost like a continuation of med school. We had to study. I studied, I think, more in residency than in med school because, first day you're given these giant books, and you do have to, um, unfortunately, memorize every single disease, but not just the disease. You have to memorize if they have genetic defects, the gene that causes the disease, the proteins that are malfunctioned, and every characteristic about the skin conditions. But yeah, you just have to, you go to clinic in residency, you work in clinic from whatever 8 to 5 or whatnot, and then you got to come home and you're expected to read and study, and you get tested every week. We had lectures on Fridays, so we would get called out and be expected to know the answer to certain differential diagnoses and treatments. But yeah, we had to study a lot, and there's a huge board exam at the end of the residency.
Yeah. So that's kind of your residency is a lot of clinic, right? What
Yeah.
was your med school like?
Med school was, I went to UCI med school and I loved it there. You know, it was classes every day the first 2 years, standard. And then there's options of like volunteer activities or clubs after. And then third year of med school is when you have your rotations. Back then we had the primary like core 6 rotations, like internal medicine, pediatric surgery, OB, and psychiatry and general surgery, and then family practice. Um, and then third year, yeah, you have exams at the end of every rotation, so you do have to still study a little bit. And then fourth year is when you mainly can do your electives and try to focus on the field you want to go into.
Yeah. Um, was there another specialty that you maybe considered before deciding dermatology?
Yeah, I mean, I knew I wanted to do something in the outpatient field versus being in the hospital inpatient. So I thought about ophthalmology, because that's also a nice mix of medicine and procedures. Um, I thought about anesthesiology and radiology as well. Those are the main ones. But then I kept I noticed I kept drawing myself back to dermatology. Uh, I enjoyed being in clinic and I enjoyed seeing patients get better right away.
Yeah. You ever heard the acronym ROAD
Yeah,
for
this is I think I just named all of them. Yeah. I was that kid. Yeah.
Yeah, that was I don't know, that I don't think anyone that I've talked to has said, exactly all of that.
Yeah, I guess I admit I was try I worked hard in med school so I could, I don't know. No one's relaxing these days in medicine. I'll put it that way. No one's chilling. Yeah.
Yeah, that fair enough. Um, what really drew you to the more the outpatient side rather than being, like, in the hospital?
In your third year of med school, you're automatically thrown into the hospital. You don't know what you're doing. You're waking up at 5, 6 a.m. You're gonna wake these poor patients up and trying to get their vitals and ask, "How are you doing today?" And, this as on the other side, I really feel bad for those patients now who have to deal with this kid. Um, but I think, inpatient medicine, it's obviously it's a great, important field. But I wanted to see patients walk out the door and feel better. You come in dermatology, you come in with a cyst on your face and you leave without the cyst, 30 minutes later. You come in with a growth or on your skin and it's gone. So I wanted to see immediate improvement versus, being in the hospital for weeks, months. Yeah.
Yeah. Yeah, and sometimes it's really difficult when, you've seen someone in there for a really, really long time, they're just
Yeah.
not getting better.
Yeah, exactly. Most, I would say almost all most conditions in dermatology we can get better. There's always new medications coming out with novel mechanisms that help too.
Yeah. So, and you said that your residency was in clinic. I'll say that again. Was there anything that you had to go into the hospital for?
Yeah, there was we did do a inpatient consult rotation where, like, the internal medicine team or any team or the hospitalist team would consult you, and you have to come in and see the patient at their bedside. Yeah.
Yeah. And what kind of conditions would you see on that service?
Uh, I there was some really interesting rare conditions, a lot of, like, vasculopathies, vascular diseases, non-healing ulcers. I remember there's patients with full body eczema or pustular psoriasis. So it's conditions that, the internist had never seen before, and that's where our expertise came in.
Yeah. Um, what kind of medical student do you think would be interested in dermatology?
Uh, you'd have to obviously, number one is you gotta do well in school. You always have to study hard. I think a med student who wants variety and who can multitask and who's quick thinking and quick on their feet. Um, but yeah, I'm trying to think what other characteristics. I'm trying to think of myself, but what I thought back then. Someone who also wants a work-life balance, I think, yeah.
Yeah. Yeah, pretty much most medical students.
Yeah, I know, I don't know, I'm assuming derm is still very competitive in medical school, but
Yeah. I think right now it's like the most competitive residency to try and get into.
yeah, I graduated med school in, 2010, 2011. It was still, yeah, that and, like, plastics and ortho, I would say we're at the top. Con
Yeah. Yeah, I think it's always like dermatology is really high and then lots of like really hardcore like the neurosurgery, like cardiothoracic surgery and all those really tough surgical fields.
Mhm.
If you had an inkling as to why, what would you say?
As to why derm is the most competitive?
Yeah, why do you
Um
experiment all these other really hardcore specialties?
I think I really do think it goes back to that work-life balance. I think derm does have this reputation of being more friendly to your personal, personal environment or, I don't wanna use the word "cush," but people do think it's cush. Um, so for that reason, because medicine is just becoming draining, and sometimes for doctors, it becomes soul-sucking. Fortunately, derm, we do still have some life. Um Yeah, I really
Yeah,
do think it goes back to the work-life balance.
yeah. It's always it's becoming more of a factor for a lot of people because they're seeing, like, their attendings or their residents just being, like, completely drained, and they're seeing themselves 20 years in the future and saying, like, "I do not want that to be me."
Yeah,
So,
but I mean, also, I know plenty of dermatologists that are drained too. It's just a different kind of drainage. Yeah.
yeah.
But at the end of the day, you get to go home to your family, so that is the positive aspect.
Yeah, it's not, like, 14-hour days, like, rounding and doing all of those things.
No.
Yeah. So, let's talk about some skincare. What would you say that most people neglect while taking care of their skin?
Well, these days, I think, people are wearing sunscreen, so that's number 1. Um, you know, let's say teenagers with acne, I think they're aware they gotta wash their face regularly. A lot of teenagers are very active in sports these days. So, wash your face after exercise. A lot of boys I see wear their hair down now too, so gotta keep it up at least at home to keep the oils off their skin. Um, Most patients are honestly in tune with skincare these days, sometimes too much, a lot
Mm,
more than me, honestly. They come in with bags of products they saw on TikTok or whatnot, expect me to know all of them. Obviously, it's not realistic, but, I still just go back to, sunscreen, vitamin C serum is a good antioxidant that helps too, and then for patients who want that more anti-aging effect, a Retin-A cream at night would help too, tretinoin cream.
yeah. Would you say that it's kind of a skincare is a kind of less is more game?
Personally, as a dermatologist, yes, I think so. Again, everyone is a skincare expert these days, especially on social media. So less is more for sure. I see way too many allergic contact reactions to these products, or they'll occlude their face and cause acne breakouts. So
Mm.
yeah, I like to minimize things for sure.
Yeah. I wanna talk to you about Accutane because I know a lot of kids that, like, in my high school and around my age are taking Accutane or have been taking Accutane for a long time. Is that something that is, like, is this a new thing? Talk to me more just about it in general.
I mean, is Accutane a new thing or taking it for a long time?
Like, both.
No, I mean Accutane's been around decades, several decades. Um, it has a bad rep out there still for some reason, but I'm a huge Accutane prescriber, and I believe it. And I think it's one of the few medicines that actually transform people's skin. It's one of the only cures for acne. So no, I'm a huge fan of Accutane. It gets a lot of bad press with kind of like the mood changes it can cause.
Mm.
I think that's controversial. I chalk it up to just teenagers in general. So no, I mean, no offense. People have,
Well,
but we monitor them. We see them every month. And of course, the number one thing is it causes birth defects in females who get pregnant. So that's the one thing we always, truly watch out for and take seriously. But no, it's a great medicine. It shrinks the oil glands that cause acne and cures it. So I like to get patients on sooner than later for that. I'm usually the one recommending it.
yeah, okay. It's good to hear it from the horse's mouth, I guess. I
Yeah,
don't know
yeah.
what you're saying, but
Almost all dermatologists love Accutane.
great. That's good to hear.
Yeah.
Um, so would do you see like, when I was in your office recently, I see a lot of, like, a really varied patient population.
Yeah.
Can you kind of run us through some of the most common conditions you see throughout these different populations?
Yeah, I mean, so we see the whole demographic of patients from babies to teenagers to adults to elderly patients. So, babies, when we see babies, they usually come in referred from their pediatrician for stubborn atopic dermatitis or eczema that they're born with that the pediatrician is managing, but they want secondary help with the management of topical steroids because you don't want to use that for too long. We see babies. What else? Sometimes birthmarks. The pediatrician wants us to evaluate and make sure everything is okay. Um, then kids, we see tons of warts and molluscum almost every day. So molluscum is kind of like the cousin of a wart. It's another virus that can cause certain bumps all over the skin. Um, we see what else do we see in kids? Yeah, eczema in kids as well. And then on to teenagers, we see a lot of acne, also warts, and then more in the younger demographic, we start doing our mole checks, skin checks. Patients come in with a family history of melanoma or just a lot of moles that they want evaluated. So I take a look and make sure all of them look okay. And if there's suspicions, once we biopsy them, um, and then, as you get into like 40s, 50s, then some of these patients start developing skin cancers, especially if they're from the generation that wasn't wearing sunscreen. So those are patients that become our surgical patients, where we're always cutting out their skin cancer before it gets out of hand. And then the elderly, yeah, mainly we do a lot of skin checks on them too. So as you age, you start developing a lot of growths. Fortunately, a lot of them are benign. There's growths called seborrheic keratoses, which are kind of these warty-like bumps. A lot of patients, when they get their first one, they get worried and they think it's skin cancer, so they come right in. But there's a lot of reassurance. And then a lot of patients have precancerous lesions called actinic keratoses. So that we use something called cryotherapy or liquid nitrogen to freeze them and treat them and prevent them from progressing into skin cancer. But yeah, it's just to recap. We go from eczema and birthmarks in babies to skin cancers in adults and elderly. So we see the whole gamut. And of course, in between, there's the cosmetic aspects of Botox, fillers, lasers, just anything patients want can do to improve their appearance too.
Yeah, and you mentioned a few times that a lot of patients are coming in with, unrealistic expectations for um, their skin clearing, or I guess like the laser or the Botox. What does that conversation look like to try and manage their expectations?
Most of the time it's harmless, it's fine. They want, let's say they just want their acne cleared right away without using, without using chemicals. A lot of patients will say, or so they don't want to do like Accutane or oral antibiotics, which is fine, but they expect their cream to clear their acne. But sometimes acne creams can irritate the skin even more, so it becomes the cycle. What else? Or patients come in with 20 different lesions. They want them all removed and, treated, and they want no scarring at all. But we have to set the expectations. Hey, there is going to be small scar. And I personally, if a patient comes in for a cosmetic mole removal, I won't do it if I think the scar is going to look worse than the actual mole. So we do have to set that expectation. But in our practice, I mean, again, we've been around for. My brother started the practice about 20 years ago now, so we have, we know the patients in the area for the most part. So patients come in, and we have a good reputation. So patients come in with a positive attitude for the most part.
Right.
Yeah,
That's great.
yeah.
Yeah. Um, so also now, you said that some products can irritate your face. Are
Mhm.
there, like a specific, like, group of products that you would not recommend to anyone?
Um, you mean in terms of what we prescribe?
No, and, like,
Um,
what you prescribe and, like, over the counter and just, like, overall, like, things for to help for your skin
I
that
mean, you have to be careful with certain benzoyl peroxide products. If you're using too high of a percentage on your face, like 10%, which is sold even over the counter, that can really irritate and cause a chemical burn on the skin. So we see a lot of that. I'll prescribe an acne medication called like clindamycin mixed with benzoyl peroxide, and the patient will slather it on their face, and 3 days later, we get a phone call, my skin is burning. So yeah, we just have to set those expectations. Like, back to like TikTok or whatnot, there's a million recommendations and products out there. I personally don't follow it. But we sometimes what's a good I forgot, there's some recommendations out there like actually I don't even know off the top of my head. Never mind.
yeah. What are some tips that you have for like someone to navigate through the TikTok skincare world so that they can be careful of what they're seeing and what they know is good or bad?
Yeah, I mean, follow a board certified dermatologist if you want real skincare tips. That's it. Yeah. It doesn't matter how many followers a certain skincare expert has, honestly, because a lot of it is just marketing and self-promoting. But if you want the true, like, simple nitty-gritty without all the fluff, just follow a board certified dermatologist for your skincare tips.
Yeah. I mean, I'm yeah. um yeah, let's see. What else? What are some new technologies that you're seeing that are really exciting you?
In the medical aspect of dermatology, there's a lot of new medications coming out for psoriasis and atopic dermatitis. These field of biologics, which are medications that they don't they're not they target the specific chemical or interleukin that causes the inflammation that leads to these conditions. So the medications are becoming a lot more specialized and specific. So that's the aspect of medical dermatology I like. There's conditions 10 years ago we wouldn't be able to help much with, but now we can in a matter of months. Um, Surgical dermatology, there's always new like methods to close a wound or new techniques for flaps that I enjoy learning about. And of course, cosmetic dermatology, there's always new innovations in lasers. Um, and there are fads sometimes and trends in cosmetic dermatology, and oftentimes it's just a tweak of an old and tried treatment. Um, But yeah, there's always new lasers coming out. Sometimes too many, and when a laser rep comes in to tries to sell their laser to you, you have to kind of take a step back and realize, yeah, I don't think it's that novel, or it's not going to be a game changer.
Yeah. I mean, there that's for every specialty. You got drug
Sure.
reps coming to you doing all that stuff.
For sure. So you know about the reps. Yeah. Yeah.
Yeah.
Everyone's trying to push push their product, but you have to, as a physician, you have to do what's best for the patient, for sure.
Yeah. And and I hear that biologics are used a lot in, like, rheumatology, and also, I know that they do like, stuff with rashes. What's like, the difference between, like, a rheumatologist seeing a rash versus you dermatologist seeing a rash?
Rheumatologists mainly see rashes secondary to connective tissue diseases, like lupus or conditions called dermatomyositis, scleroderma. So these are more usually autoimmune or autoinflammatory conditions that a rash is sometimes they present with a rash, but oftentimes we work alongside a rheumatologist, whereas they refer us for a biopsy of the rash, or they ask us if this rash is a manifestation of their underlying connective tissue disease. So once we work together a lot. Um, but yeah, rheumatologists basically treat the whole body connective tissue disease.
Yeah. Yeah. Are you seeing any novel uses of, like, AI in the clinic, or, is that still something that's on the horizon?
I think with AI, we're just, as everyone will tell you, just at the very, very tip of the iceberg, when it comes to medicine. In dermatology, there are a lot of these AI apps like you can download, and just take a picture of your mole, and it'll tell you the 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 component of how atypical it is, or whether you should go get it checked or biopsied. So some patients come in having used that, but oftentimes it's not very accurate. Like the AI app will tell them this is definitely a skin cancer, go get it checked, and they'll come in and it's this benign seborrheic keratosis. So it's not there yet, hasn't affected us personally. um, who knows? Again, we're just at the very, very beginning of it. So who knows what's going to happen in the next decade, 20 years. Um, in terms of clinic flow, there's AI apps that can help with your clinical notes. You transcribe in it, you dictate and it transcribes it beautifully, or it listens to the patient speaking and it does your notes for you. That's coming out of the next year or two for us in dermatology. I haven't used that yet, but yeah, I'm sure AI will be incorporated in every aspect.
Yeah. Is there any part of AI that you're really excited for it to start coming out?
Not really, to be honest. Yeah, sometimes I'm a little worried, is are we gonna be replaced by robots as dermatologists? But hopefully not. Everyone still wants that personal touch and critical thinking that I don't think AI can do yet.
Yeah. It's
Um,
also the matter of how are they gonna, like, actually do the injection or, like, the
the
procedure.
procedure, yeah, I mean, I feel like it's gonna get there one day, honestly. It will.
Yeah. Well, fingers crossed.
Well, I need another 20 years. We're good.
Alright. Well, at least that's a decent buffer, I guess.
Mm, we'll see.
Yeah. So I want to ask a few more reflective questions. So if you could go back to your like 18-year-old self, would you do anything? Would you change any part of the journey that got you to be here right now?
To my 18-year-old self. Is that how old you are? How old are you?
17.
Yeah. Yeah, it's a lifetime ago. I would tell myself, venture out a little bit more, live elsewhere, I think I'm very happy that I went to UCLA for undergrad, because I was still maturing at the time. But for medical school, even though I loved UC Irvine and I think I got a great education there, I think I do wish I went elsewhere across the country, because ultimately, especially as a Persian Jewish kid, you're gonna come back to LA most of the time and live here. So it would have been nice to spend 4 years, or in a residency 4 years elsewhere, and experience the different culture, different climate. So I would that's one regret I do have, but I mean, I'm very fortunate to have been close to my family through this whole journey.
Yeah. Do you think that, like, staying in Southern California, helped you, like, build more connections or things like that?
Not so much in resident doesn't matter where you go in residency. No, I mean, honestly, in when I was in residency, I didn't have to apply to jobs because my brother already had his practice established. So I was fortunate enough to be able to just join immediately. But I'm trying to think if I guess it'd be a little harder to find, yeah, jobs in your local area, but it's not a deal breaker at all, at all.
Alright. Then, I guess that's comforting to hear for someone who's a little bit scared to just kind of, go out there and see what's on the other side of the country.
I would do it, yeah. For my own kids, maybe not for college again. I think college, if you can stay close to home, because between that 8 years of 18 to 21, your brain is still maturing. But I think for grad school, it's worth going elsewhere, and I really wanna, promote that to my own kids. Go
Yeah.
experience something else and then come back to us.
Yeah. Um, yeah, what would you tell the medical student who's, like, applying to dermatology? What kind of advice would you give them in that, like, critical time?
I mean, I'd say if your med school has a derm department, just go set up a meeting with the chairman and just say, I'm interested in learning more about dermatology. You don't have to be set on it, but you could say this is one of the fields I'd like to explore. So you want to ask about potentially research opportunities if there is a lab. Um, and then I think, one one piece of advice I would give is try to do a mission abroad type of trip too, um, especially if you're interested in dermatology. Um, there are these different mission trips where you can go see skin diseases in impoverished countries and see how they treat them or not treat them. You get to see presentations of skin diseases that you wouldn't see in Los Angeles because these conditions are being ignored and they're advanced to the stage where you wouldn't otherwise see them. Um,
Yeah.
but yeah, I would say try to do a travel trip because that also will spark interesting conversation in the residency interview. As when I was a resident, I was a chief resident. I sat in on interviews and I interviewed potential applicants. You while the research could be interesting, I thought I was a lot more interested in their travels and extracurricular activities outside of med school, for sure. So yeah, do something that you enjoy. It doesn't always have to be like, I gotta get to the finish line. I need to do this, this, and this. You can go at your own pace. Um, and a lot of med students, I think, are taking an extra year now to figure that out, do research or do a volunteer activity. So yeah, go for it.
Do you is there an interview that, that you sat in on as chief resident that, like, will always stick with you?
Um, a lot of med students, they share their personal stories and their personal backgrounds of why they went into medicine. Did anything stick out personally? I remember there was a person who had won like a bronze medal in in the Olympics, which I thought was fascinating. Like how do you even to even get to that stage, you have to be a full time athlete. So that was very impressive that they went to med school and could balance that.
Wow. That
Yeah,
I'm
not
that's
every
great.
applicant, not every applicant is like that.
Yeah. Yeah, we're gonna have some people that are definitely gonna start trying.
Yeah, yeah. Go join the Olympics, everyone.
Yeah.
That's my advice.
I'm just get into med school now.
Yeah, you got to get at least the silver.
Yeah, well, he didn't get in because he only had bronze.
But yeah, you're whack. Only a bronze.
Oh my
No,
god.
it's a competitive. Some of these people they come. I mean, but I think what you're doing is a great thing. You're a self. It shows that you're a self starter with this YouTube channel. So I think that's potentially going to look great on your application.
Yeah. I try my best.
Like thinking outside the box. That's great.
Yeah. So, what would you give to, let's say, the 18-year-old who wants to be a dermatologist? What advice would you give to them?
I would say, well, as an 18-year-old, just do well in college. Don't, do things outside of school too. Join as many clubs as you can. Even if it has nothing. If you want to go into med school, you don't have to join a club that's gonna help you get to med school. Join a club because you're interested in that field. Take classes outside of your major. One of my favorite classes at UCLA was Italian cinema or the myth of Greek acting. So just try to explore other options because you're never gonna have this opportunity again. After college, after med school, your day kind of becomes a very much of a routine. But in college, you have all these opportunities to travel, to volunteer, to join clubs, to make friends. So, everyone has tunnel vision in college because they're trying to get to the next step, but just try to take a step back and enjoy what's around you. Um, I live near UCLA, so now when I go back to the campus, I'm like, it's really an amazing place. It's beautiful and yeah, there's just so much opportunity.
Yeah, and especially when you're young, you have way more time to just kinda go see what's up and
A
or
lot more
well,
time and a lot less responsibility. Yeah, it's great. It's great to be 18, 17. Yeah. At the same time, I remember it's very stressful because again, you're trying to get to the next step, but take your time, take as much time as you need, honestly, and that's something I would tell my kids. If you need an extra year, 2 years to 3 years to explore and you can you can go into a complete different job. I had friends in med school who were previous teachers, bankers, different life experiences, and that does shape you.
yeah,
So
and and everyone who, like, that I've talked to that have done, these non-traditional paths, they all say that they learned something in their previous job or that they didn't learn in medical school or
oh,
some
for sure. Yeah, med school doesn't really teach you any life experiences. You're just study, 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 work, work, work. Yeah.
yeah. Would you even say, like, to the, someone who's really gunning and really has the tunnel vision, just take, like, maybe a few months or a year off, even if they know that they're, like, 100% gonna go to medical school?
If they want, I mean, if that's what's gonna make them happy, sure. Yeah, yeah. I mean, I would say at least, like that summer, one of the summers of between college, yeah, go travel abroad. Do something that in the future you're not gonna have time for.
Yeah,
Um, and then as a college student, you don't you like the resources or funds are not high, but they'll come.
yeah, yeah, I'm kinda being a little selfish right now, asking those kinda questions.
Are you trying to take a longer
No, I'm just like, you know, I'm super I'm super hyper focused on, trying to do well in college and get into medical school that sometimes, you just gotta see what's out there, and I've thought about it, but I've never really, taken it seriously. It's like, "Oh, this is like, something that, someone is still exploring needs to do," and I'm not. So, you know, it's still good to see what's out there even if you
Yeah, everyone has a different personality and purpose, and you just have to figure it out. I mean, as a 17-year-old, I didn't really I was all over the place, and that's totally okay. Yeah.
Yeah. Alright. That's all I have for you today. Is there anything you wanna ask me or say in general?
I mean, to all the potential, med students out there, just yeah, I'd say take your time, don't panic. You will always, always, always get to your goal no matter what. Sometimes it can just be a little longer process, but stay on course. And yeah, don't settle for less.
Yeah, that's great advice just in general, not even for the pre-med
Yeah.
or meds.
Yeah, and just watch all of Elon's videos. There you go.
Alright, thank you so much, Dr. Ghasri. I
Yeah,
really
bud,
appreciate
you got it. How's your ear feeling? All good?
Pretty good, yep.
Okay, good.
Alright, I'll see you around, doctor. I
Yeah.
appreciate it. Thank you.
You man, say hi to everyone.
Yes, sir. Bye bye.
See you, bud.